Hey everybody, Bob Lazaro from All Things Leland. Thanks for joining us. For those of you in Brunswick County, sixth fastest growing county in the United States. By median age, the oldest county in North Carolina, and the Wilmington region is the seventh fastest growing in the United States. Put that all together, uh, regardless of traffic, there is a great need for healthcare access in our region. And I'm pleased to have Ernie Bovio, the regional president of Southeast Coastal Market for University of North Carolina Health, to talk about their recent proposal to build a 200-bed hospital in New Hanover County. Ernie, Mr. Bovio, thank you for joining us.
Yeah, glad to be here. Thanks for having me.
You're welcome. I mean, let's get right into it. People have read the media reports, but perhaps you could give us a little bit detail on the new facility that you are proposing.
Yeah, I think, the combination of the population growth in the region and the demand for healthcare services is outpacing the availability of those services. There's an unmet need, and UNC Health has had a presence in the community focused on pediatric subspecialty care. And after just hearing from the community, listening to the residents of the region, it's clear that they want more healthcare, more access to primary care and specialty care. And they want an alternative and a choice without having to drive 2 hours for that
Mhm.
alternative. And so we're really excited about this proposal. There are 225 beds available in the state medical facility plan this year that can be applied for by other healthcare systems, and so we're going to apply for 150 of those beds. So we're proposing a 150 bed community hospital at the corner of 17th Street and Shipyard Boulevard in Wilmington.
That's great news. And North Carolina, like my former home state of Virginia, has a certificate of need process, which requires state approval for the beds that you're proposing in Wilmington. Can you briefly explain that process?
Yeah, it'll be a competitive process. There'll be multiple healthcare systems applying for those 225 beds. One of the most important criteria is being able to demonstrate the ability to utilize CON assets, and in this case, hospital beds, when they're deployed and operational within a certain time frame, and having the physician support, the physician commitment to use the new hospitals is critical and important. And with Wilmington Health support, in the additional physician recruitment that will take place, prior to the hospital opening,
Mhm.
we're able to demonstrate to the state the utilization of those beds. And another important criteria is competition. The state looks favorably on new or additional competition in the area where the CON assets will be deployed. So we feel very confident we're developing a strong application that will be submitted next week. June
Okay.
15th is the submission deadline for the application. Then there'll be a public comment period in August, date to be determined. That will occur somewhere in New Hanover County, and the public will be invited to come and share their support for UNC Health or for one of the other healthcare systems applying for the beds. And then the regulatory review process will continue. And by the end of the year, late November, early December, we expect the state to make a determination, a decision on how they're going to award those beds.
As you said, it's a public process, and I will share the website that the UNC Health has stood up, yourcarerighthere.com. So there is a place, if you can't go to the public hearing, there is a place for folks to submit comments that will be, I am going to assume, are going to be part of the public record.
That's right. Yeah, it's
Okay.
on our website. There is more information about our plan, more information about UNC Health, and also there is a way to demonstrate your support for UNC Health's application. There's a letter to the CON section that will be reviewing the applications. We've had such a great response. It's been overwhelmingly positive, and a number of folks have already signed on to this letter.
Okay.
And so, yeah, we appreciate you taking a look at the website if you have an opportunity to do so.
I mean I mean this is good news on the timeline. Next week, June 15th, the application goes in by June 15th, public hearing process decision in the late fall, early winter. So at the end of the day, Mr. Bovio, I mean, how do you so assuming that it is approved, then how aggressive a timeline is UNC Health going to move forward with, given the demand in the region?
Yeah, so I'll just put some things in perspective. If there were no CON process, and many states don't have a CON process, North Carolina has one of the most restrictive CON laws in the country. If that didn't exist here, and then we could have a hospital open in 3 years, maybe even less.
Mhm.
This is going to add, the process adds about, a year to 2 years to that time frame. So we're really at a minimum 5 years away from being able to
Okay.
open the hospital. So what'll happen at the end of the year is when the state makes a decision, and if I had to bet on what their decision would be, I think that they would split the beds between UNC Health and Novant Health. That's my guess. Um, and there's typically an appeal that occurs from one of the applicants that are they're not necessarily happy with the decision. Um, for example, if all of the beds were awarded to Novant Health, UNC Health wouldn't be happy about that and they would appeal the decision. If the beds were split, I think Novant might decide to appeal because they want all of those beds. Um, and so this happens in all the CON processes for the most part. And what'll happen after that is we'll enter into a mediation arbitration trying to come to an agreement on the split of the beds or, just negotiate a settlement so that we can get on with it. So that adds a little bit more time.
Mhm.
So that'll bleed into 2027 before we resolve that. And then we can get on with building the hospital.
I mean, certainly service. I mean, when you look at it, presuming that it's approved, I mean, what kind of services can residents expect from UNC Health in terms of the new facility in the Wilmington region?
You can expect all the core basic services that any community hospital would provide.
Mhm.
When I look at if I look at physician supply demand analysis for the region, there's a deficit for every specialty, primary care, specialty care. Some more of a deficit than others, but nevertheless, there's a need for all specialties, and so we're going to really be focused on the physician recruitment, filling those gaps where there's long wait times to get in to see specialists. Um, but cardiology, neurology, oncology, orthopedic, surgery, emergency medicine, I mean, the whole gamut that we're going to be able to offer. Now, some of the super subspecialty intense things we'll have to grow into over time.
Mhm.
But we'll have all the general services that a community hospital would have.
Thank you for sharing that with us. I mean, for those, again, application is submitted by the end of next week. Then we have a public hearing process over the summer. You can visit the website, which I will share if you wish to send a letter of support or not, and look for some sort of decision in the late fall, early winter. With that, I want to thank you. I know you're very busy. You have a lot of responsibilities, having worked in healthcare in a previous life up in Northern Virginia. I know how busy and how competitive it is in terms of services and recruitment, etc. Thank you, Mr. Bovio. Appreciate your time and look forward to seeing how the public hearing process plays out.
Thank you very much for having me.
You're welcome.